I care about people.
We always will be committed to fundamental human rights, to human dignity, and to individual freedom.
We have to look out for each other.
When he says that, I agree. He said that when he sees something that doesn't work, he changes it. We all hope that our Prime Minister will change things, that he will fight for good Canadian healthcare for everyone, like he said he would, because in this country,
healthcare is a fundamental right, not a privilege.
It is extremely scary to feel like your neck is breaking and it can't support your own head and there is no help available and you just have to wait and hope that something changes.
For over 30 years, more intensively in the last 10 years, many countries have published medical imaging-based research on CCI. Australia, Spain, the United States, India, Poland, the United Kingdom, etc. But here, it's like it doesn't exist. And so we
traite cette condition de la même façon qu'on traitait l'épilepsie en l'an 1800, avant qu'on sache que les crises étaient causées par des lésions cérébrales.
Except science has proven what CCI is, and there is enough data to develop patient care. They say that Canada trains the best talent in the world, so why are we not the best at assessing and treating CCI and all its complex related conditions?
We literally don't have time for you to catch up. We need Canada to help out now. Patients like me have waited so long.
So Canada must act now, for Canadians' sake, because leaving us to survive by our own means without help is not a solution. Among our Facebook community of over 900 Canadians, many have received a diagnosis outside of country. Some, rather a confirmation by a physiotherapist or by one of the rare Canadian chiropractors familiar with this condition. Others, who cannot afford to travel for any evaluation, simply have the symptoms known to be associated with CCI. But all of them only discovered this community because they were looking for answers. In October 2025, we conducted a survey among our community, and 124 Canadians from 9 of the 10 provinces responded. Many patients are told that their problem is mental.
Even though this pain is the most real and constant thing in your life, almost no one believes you.
She believed that my symptoms were psychosomatic.
A neurologist diagnosed Mark with conversion disorder, claiming that his brain was perceiving the pain that wasn't really there.
On m'a même dit que tout était dans ma tête, que je me faisais ça à moi-même.
I said it's psychological, pass you to a psychiatrist.
We were repeatedly told it was anxiety and were offered mind-body connection therapy.
Psychiatrists want to pass you back and say it's physical, so nobody wants to do anything about it.
Le plus dur, c'est d'être effacé.
This really is a mechanical disorder, but the medical misunderstanding causes a lot of psychological distress among the community members who feel invisible, abandoned, powerless, and voiceless.
Je suis sortie de ce rendez-vous-là, puis j'avais complètement perdu espoir.
I felt completely unvalidated and unheard.
Je me sens abandonnée.
Imagine if a sprained ankle was unknown to medicine. You're walking down the street, texting on your phone, when suddenly you step in a hole and stumble. Unable to walk on your foot, you go see your doctor. He examines you and orders x-rays. Since they don't show any fractures, he concludes that everything is normal. There's nothing wrong with you. But you insist because even though you want more than anything to walk on your foot, it simply doesn't work. Every time you try, your symptoms only get worse. The doctor then explains to you that normal tests indicate there's no problem. So if you can't walk on your foot, this means your symptoms are an illusion of your mind, that everything is mental. Would you think it makes sense? Referring someone to psychiatry for craniocervical instability is as ridiculous as referring them to psychiatry for a sprained ankle. Both are ligament problems, not mental. Not to mention that CCI is visible on medical imaging, but if Canadian doctors don't see it, it's because they don't have access to the right diagnostic tools and aren't trained to properly detect the problem. One of these tools is digital motion x-rays. As you can see, instability at the skull and neck junction caused by a lack of support from the surrounding soft tissues truly is a serious structural mechanical problem. Knowing that the spinal cord, nerves, and important vessels are hit, stretched, and compressed with every movement, would you be surprised to learn that such a condition results in a wide range of symptoms? From the responses we got, the 5 most disabling symptoms are pain.
Pain I live with every single day is absolutely debilitating.
Severe, unrelenting, burning pain.
There's very few positions that are comfortable for me.
Brain fog.
Severe brain fog.
Cognitive decline.
Intolerance to upright positions.
I feel like my neck is incapable of supporting my head, that my head is too heavy.
When he tried to stand, he became dizzy and even fainted on several occasions.
And I'm not able to be upright for a long duration.
Being upright makes it worse.
Lack of energy.
Fatigue.
Exhaustion.
Post-exertional malaise.
Headaches.
24/7 head pain.
Extreme pressure in my head.
Trop de pression dans la tête.
And headache.
CCI feels like a very simple mechanical condition, but it has severe neurological implications.
Numbness in my hands and in my arms.
Tingling.
My neck muscles were in permanent spasm.
Des myoclonies, des dystonies aussi.
J'ai des pertes de conscience fréquentes, des convulsions.
Not being able to walk properly.
Experiencing paralysis.
Plus capable de marcher.
Des problèmes au niveau auditif.
Tinnitus.
The visual disturbances.
Intermittent vision loss.
And a severe vocal tic.
Difficulties with my autonomic function, including my heart.
Tachycardia.
Temperature regulation issues. Digestive issues.
Balance issues.
Constant dizziness.
Really, really bad vertigo.
Bouge pas puis ça tourne. Pendant des jours cloué au lit.
Feeling nauseous.
Sleep cycle irregularities.
Je suis plus capable de supporter la voiture.
Try to go in a car for like 2 minutes. It doesn't matter. It made me feel like I'm going to die and I have to lay down, and it doesn't even go away as soon as I lay down. It lasts days and days and sometimes weeks and weeks.
Pretty much anything I do makes my symptoms worse, at least temporarily, if not permanently. It's like being trapped in your own body.
People with joint hypermobility, especially those with connective tissue disorders like Ehlers-Danlos syndrome or EDS, often suffer from CCI. And according to a study, they are also at higher risk of needing a fusion of the skull with the upper spine. In fact, CCI can strike anyone, mostly young and active people. According to the survey, 3/4 of respondents were under 40 years old when their symptoms began. At this age, people are active, moving, playing sports, going to school, or working. This is the age when we realize our dreams, when everything is possible. It is the age that CCI strikes most often and destroys lives.
Un accident d'auto.
After the car crash, I thought it was just cognitive fatigue from travel.
I was in a motor vehicle accident.
After hitting my nose on a grand piano.
After a serious fall on a slip and slide in my own backyard.
Every year, nearly 28,000 people are injured in car accidents, and there are 45,000 cases of mild head injuries in Quebec alone. That means CCI can affect a lot of people, but they won't know it since in Canada, we don't evaluate it. So all these people go unprotected, and if something else happens, they may become disabled.
Avec la progression constante de ma maladie.
I was born with spinal deformities and a connective tissue disorder, both of which predisposed me to having instability. Over the years, different injuries and infections, times where I've overexerted myself would cause new and lasting neurological symptoms.
À l'âge de 10 ans, suite à une migraine insupportable, j'étais gymnaste.
Our son, Mark, was just 8 years old when seemingly out of nowhere, Mark began having episodes of breathing difficulty. He developed difficulty swallowing. He began losing his balance, struggling to walk, and experiencing intense pain in his neck, back, and chest.
I had a minor surgery for a deviated septum, and an error occurred, and I had to be intubated, and during this time, I received a neck injury.
Chirurgie qui m'a aggravé au point de devoir cesser de travailler.
After experiencing some tension and aches, I visited the ER and was cleared as not having anything serious. I then made the error to go to the local chiropractor, which performed high-velocity thrust neck manipulation. I ended up being bedbound.
Something that could have been avoided with an early diagnosis of CCI.
Il y a 3 ans, je travaillais en même temps de faire ma maîtrise.
My CCI symptoms started 3 years ago.
In May 2022,
Il y a à peu près 5 ans.
10 ans que je suis comme ça. Almost 12 years ago now.
In 2011.
For 16 years now.
For 3/4 of respondents, the symptoms appeared more than 5 years ago, and more than 10 years ago for almost half of us. All this time of suffering and disrupted lives without any support from the system. Even though treatments exist, this needs to change, especially considering the 2 following impacts.
I've lost my life completely.
Plus aucune qualité de vie. Mon pronostic vital est en jeu.
I am bedridden all the time.
Je peux plus sortir de mon lit.
I was bedbound a lot. I couldn't function. It was really isolating.
Je peux plus sortir de la maison.
I miss out on many family activities, so many family gathering and holidays.
I'm not able to travel in a car. Having access to care is impossible.
Leaving the house worsens symptoms for most of us, which is why we avoid doing so.
I require a lot of assistance from my husband and my extended family.
Prior to this accident, I was becoming a counselor. I was somebody who also would spend time volunteering.
I'm presently not working as a social worker. I'm also a mom. My children miss that a lot.
I've missed most of my son's childhood.
Je me suis battue pour avoir des réponses. Tout ce que j'ai eu, c'est compliqué, tout est normal.
People struggle to survive while having to find physical help, or for some, a place to live, and
there's no help. So I get out of hospital and then I find out I'm evicted, so I can't go back to my place. I've tried everywhere in the Lower Mainland to try and get help to have a home, to have a place to rest. I do right now, but not tomorrow. There is nothing for people like me with physical disabilities that are dynamic, that change over time.
With a low income, sometimes none, but a lot of expenses.
Ça aurait coûté moins cher au système de santé de s'occuper de ma condition plus tôt. Surtout que je pourrais encore travailler comme intervenante en santé dans le système à aider les autres au lieu qu'on m'aide moi.
In addition to sometimes having to fulfill our role in society as caregivers, among others, the public system ends up paying for many unnecessary consultations and exams for us due to the lack of knowledge about our condition here.
I saw different neurologists. I had several MRIs, which were all read as normal.
I have seen a lot of specialists.
Innombrables hospitalisations durant la dernière année. J'ai une grosse équipe au CLSC qui me donne des soins, qui vient à domicile. Le gouvernement paye pour ces soins-là.
The majority of us have had to stop working, lost our income, or rely on disability benefits. With less money, we have to buy equipment, pay for personal assistance, or private consultations.
A digital motion x-ray, it's not available in Quebec. The test revealed the diagnosis of CCI.
I had to pay out of pocket and leave the country to reach specialists that could radiologically validate that my instability is real.
I was able to book a PICL procedure to Colorado.
We've spent thousands of dollars seeking answers, traveling for imaging, and paying for treatments that were unavailable in Canada.
I sought out the opinion of a neurosurgeon in Barcelona. He needed imaging called a cone beam CT of my C-spine, something that is not available in Canada. It's done in dental offices for the jaw. We don't do it for the neck.
During those years, I was diagnosed with a lot of different pathologies, and I saw so many different specialists, but this condition, which was my most severe pathology, went undetected and untreated.
Cost the healthcare system a lot of money.
According to the 2018 Parachute Report, the total lifetime cost to healthcare and society for injuries that can lead to CCI was $22,165 million. Not only would Canada reduce this cost with an early diagnosis of CCI, but it would be beneficial for us, for society, and for our government.
It's the most efficient thing to do.
If CCI was assessed and treated in an early stage,
my life would look completely different.
I would have had better tools to know how to take care of it.
I wouldn't have been cleared to receive manual spinal manipulations, and I would still be functional.
I would be able to meet my most basic needs independently.
Je n'aurais pas été invalide et handicapée à l'âge de 44 ans.
I would have still kept my remote job, which I lost.
I'd be able to work a job.
J'aurais pu éviter d'arrêter l'école.
I wouldn't need the support of a family member, which left their job to come to assist me.
Éviter de rester isolé chez moi pendant des mois et des mois.
I'd be able to give back to my community more.
I wouldn't need to have countless ER visits, MRIs, CT scans, X-rays, blood tests, etc., just to rule out things that it was obvious I didn't have.
Because this pathology wasn't understood, that was preventing me from getting better.
J'aurais pas détérioré, ni eu besoin d'une chirurgie une quinzaine d'années plus tard.
But instead, in the absence of specialized care or clear clinical direction,
Patients are seeking MAID.
I don't think MAID should be the only answer.
The only option was MAID. That's all Canada gives you. I'm scared I'm not gonna make it because there's no help. The only way to get help is to fundraise and to get out of country to get the help that you need.
and this, even if the Ministry of Health could pay for out-of-country care.
I have spent over $600,000 seeking diagnosis and treatment out of country as I am left to die in Canada in my bed with 3 young children.
If nothing changes, my only option will be MAID.
Please just listen to us when we go consult a doctor or when we advocate for ourselves. We're not seeking drugs or attention. We just need relief and understanding. Is this how we want the world to see us? As a country who helps end the lives of its citizens instead of treating them?
I have this maybe condition, craniocervical instability.
My doctor's willing to help me, but there's nowhere for me to go when we're so very, very behind in Canada. I don't even know if surgery is the answer, but I would like to talk to someone who at least understands what is happening.
My goal is that more people can learn about this condition, be diagnosed with this condition, but also for more physicians to know about it.
My hope is that I would have better financial support to have better access to care.
That CCI will be recognized
as a debilitating condition
and understood within the healthcare system.
La bonne nouvelle, c'est qu'il existe des traitements et qu'on peut agir.
Canada can provide 3 key things to meet the needs of the CCI community and all related conditions. First, the right tools.
Canada needs to establish the proper dynamic standing imaging and train radiologists to read these images.
We need specialized clinics with upright MRIs, digital motion X-rays, rotational scans, CT angiography, and CBCT scans with a team of experts.
I want other people to access help sooner. I want people to have interventions that are far less high risk and invasive.
Il n'y a rien d'adapté pour l'instabilité craniocervicale ici. C'est dangereux.
Clinics that prioritize teleconsultations, perform all imaging tests on the same day to reduce travel, and are located near a hotel so patients can rest for 1 or 2 nights if needed before traveling home. Second, doctors with the right knowledge.
My hope is that patients like me will one day have access to the proper care that they need, including surgery when necessary, that research will be funded.
We need radiologists, neurosurgeons, neurologists, and nurses with expertise, health professionals who believe in fairness, compassion, and empathy. As our community has suffered from medical discrimination, many still feel traumatized. To quickly gain knowledge about CCI and related conditions, Canada could send doctors to Spain to learn from experts or invite American specialists to operate on Canadians while training our doctors. And third, a full range of treatments.
If not here, they must receive it out of country in the interim so that the financial burden doesn't fall on them and their loved ones.
Surgery should be an option.
Having to be treated for an atlantal axil dislocation, and I had fusion. I'm super lucky because I'm walking again. My sight has improved.
Along with clinical trials using autologous stem cells and a safe method of deep injection into the craniocervical junction.
6 months later, I had another PICL. After that one, I went into full remission. It was so nice to live again.
Not to mention, stem cell regenerative therapy would be a major advantage for the health system, since it could also treat many joint injuries, which would further reduce costs. And we need CCI and EDS training in physiotherapy, chiropractic, and occupational therapy.
L'ergothérapeute voulait pas que j'écoute mes symptômes parce qu'elle voulait objectiver ce que j'étais capable de faire, sauf que des symptômes, c'est là pour guider les interventions, pour nous donner des indices de ce qui se passe. Là, je les ai pas écoutés, ça m'a pas servi parce que cette évaluation-là m'a causé des séquelles permanentes, des nouveaux symptômes. J'aurais pu m'en passer. Il faut que les médecins et les intervenants en santé soient formés pour l'instabilité craniocervicale.
To ensure safe interventions, they should follow the recommendations of the International Expert Consensus.
The longer we wait, the harder it is to treat.
Everyone knows that treating a condition early is easier, less invasive, and more affordable. So here are 3 actions Canada can take to prevent CCI and protect all Canadians. First, advise modifications to current spinal surgery protocols to minimize the risk of causing or worsening instability. Second, refer to guidelines and patient guides from international CCI experts to develop our own and help prevent further harm. Third, spread awareness to medical schools and all doctors about CCI and all related conditions, including invisible symptoms, so they can learn to recognize them and act in a fair and appropriate manner. He says,
Fortune favors the bold.
So, despite our limitations living with this serious condition, we, members of the CCI community, took a chance to be bold in preparing this video, to give us all a voice, to be louder together, so our Prime Minister can hear us and see that we exist, that we are unfairly being limited to prisoners in our house and in our body, when we could benefit from treatments that exist and get better. Our future has been compromised, and we want Canada to give it back to us because we want to live. We want our place back in society, to be able to look out for each other. So let's be the best country in the world, an inspiration, a leader in the management of CCI and related conditions. We need Canada to protect us, to protect all Canadians, and take action now to give us the means to succeed.
We're in 2025, so please, let's make a change.
So, can you bring us back on track?
Thank you for listening.
À tous les Canadiens qui ont répondu à notre sondage, à mon équipe, merci du fond du cœur. Gardez espoir, on va réussir à se faire entendre. Bye bye.